and you have a transition where you need to have a shared vision, you need commitment, you have to make many changes during your working, and you are going to have your success. Historically, cord blood as a substitute for bone marrow was used primarily in infants and young adults due to the lower number of cells present in the small volume or cord blood. Available comparable relatively large volumes of bone marrow of peripheral blood stem cells can be obtained. However, recent data demonstrate that by transplantation with two instead one cord blood units to an adult, a successful outcome can be achieved. The vision is to establish an umbilical cord blood bank to use a resource in your own state, as well as nationally or internationally, for treatment of devastating diseases such as leukemia, lymphoma, and others. In addition, a repository of cord blood stem cells, DNA, or serum will be established to be used for researchers in your state and around the world. This is the development of cord blood transplant. In the 80s, Professor Brunmeyer has studied, and he knows that the placenta blood has stem cells, hematopoietic stem cells. During the last 30 years, cord blood banks and cord blood transplantation is going so fast. In 1988, Professor Jan Ludman has done the first successful cord blood transplantation. In 1993, Professor Kurber has done the first unrelated cord blood transplant. And during the 90s, beginning the evolution of the public cord blood banks, their first one was in New York under the Dr. Rubinstein supervision. After that, we had a lot of new organizations for accreditation processes, the appearance of Eurocore, ABV, FACNetCore. We have three kinds of cord blood banks: public, private, and mixed. The cord blood bank shall have a cord blood bank director, a medical director, a cord blood collection, and of course the cord blood bank shall have an adequate number of qualified staff for its operations. To keep in mind, cord blood have advantages and disadvantages. The advantages are less need for a perfect HLA match, easy to harvest without to the newborn donor or mother, no controversial stem cell SARS, does not involve the use of embryonic or fetal stem cells, decreased incidence and severity of graft-versus-host disease despite HLA mismatching, lower risk of contamination with blood-borne viruses. The disadvantages is lower engraftment times, which may result in a longer initial hospitalization and increased costs. Not all units contain sufficient cell content to transplant larger individuals and delayed immune reconstitution. In addition to the use of cord blood as a stem cell source for transplantation, currently used since 1988, it is further speculated that the stem cells derived from cord blood, for example, mesenchymal stem cells, could be used in the near future for treating degeneration tissues modifications. All of them under research protocol nowadays. Let's go to the business plan. Some options to keep in mind of how to create a new program. Scientists have stated that we are entering the age of all cells in which virtually event medicine will see direct application on cell therapies for both generalized and personalized. Degeneration tissues and organs due to aging or injury is the most common cause of morbidity or mortality in our society nowadays. New and innovative cellular therapies in the field of regenerative medicine, which as progenitor cells or tissue and organ repair, are being developed throughout the unprecedented rate. But nowadays, many cord blood banks are working under research programs not only using stem cells. For example, red cells. Because most extremely preterm infants with birth weight under 1 kilogram need transfusion, many attempts have been made to collect, process, and store placenta blood from cord blood for autologous transfusions in these cases. About plasma, platelet-poor plasma held combined with amnion improves the therapeutic effect of human umbilical cord mesenchymal stem cells on wound healing. And umbilical cord blood platelet-rich plasma containing growth factor has attracted attention as biomaterial useful for regenerative medicine. Of course, the quality requirements for cord blood are so important and many relevant. You have to know the sterility, the total nuclear cells counts, CD34 counts, viability, and colony forming units. Relevant is the direct relation between volume and the number of cells that you are collecting. On your left, you can see different options of engraftment about number of CD34. We have banks with only cord blood service and banks with cord blood and cord tissue services. Recently, during the last 10 years, mesenchymal stem cells appears as potential cells, adult stem cells, for different uses. Mesenchymal stem cells have differentiation to different tissues, and the paracrine functions are very important. For example, nowadays, mesenchymal stem cells are under research programs for using in the earth from COVID in severe pulmonary disease. But nowadays also at Duke University have demonstrated the use of these cells and stem cells from hematopoietic cord blood stem cells from cerebral palsy and autism, and they are close to receive FDA approved. When you are going to do a business plan, you need the checklist, the executive summary, the product, what you offer, market, who you offer it to, sales and marketing, your financial support, operations, management, and personnel. To develop a new cord blood bank, the business model describes the rationale of how an organization creates, delivers, and captures value like economic, social, cultural, of other forms of value. In our case, the best value to be the best health provider. 6 components which are crucial for entrepreneurs to focus on. In one sheet, crucial business essentials are pointed out to easily remind you. It helps you to create products of value, purpose, and efficiency to users, helps you prioritize marketing effort and spend to generate cash flow the quickest, helps you diagnose weakness in the venture process quickly, instills a quick progressive decision-making mindset, sanity, and reads your mind to distribute products efficiently. Here you have a model of cord blood bank. On your left, the collection center. The collection center, you have to need once again the importance of the relationship between volume and the nuclear total cells count. And you have to know the role of cells count in unrelated cord blood transplant. For example, delay hematological reconstitution, decreased risk of acute and chronic graft versus host disease, delayed immune reconstitution, increased graft versus leukemia effect, no effect on long-term survival in malignant diseases, and better survival with HLA match in non-malignant diseases. On the other side, the transplant center need to know how is going to the engraftment with a specific topic about the nuclear total cells count and CD34 positive cells. Here I show you 3 columns searching and identifying an alternative stem cell donor and the main criteria to be considered. I would like to show you only these four, the relationship without, for example, for the ABB and DRB1 and HLA typing to unrelated bone marrow transplant, unrelated cord blood transplant, and an aplus stem cell transplantation. The median search is at least 1 month for cord blood transplant, between 3 to 6 months for bone marrow, and aplu as immediate. The main limiting factor to graft in the umbilical cord blood transplant is the cell dose. For bone marrow, the HLA identity, and in the case of aplu, the poor mobilization. And the main problems to overcome are, for bone marrow transplantation or peripheral blood, graft versus host disease, in aplu stem cells, delayed immune recovery, lack of graft versus leukemia effect, and in umbilical cord blood transplants, graft failure, delayed immune recovery. Once again, the model of quality management is required, and you have to know that value into your program to provide a chain reaction to stay in business, production, improvement, capture the market, etc. You need to know the organization and its context. You have customer requirements, you have customer satisfaction, and you need results in your quality management system for offering the best products and services. This algorithm used to determine the number of cord blood units needed for those that are available. You have to know your population data, disease incidence, eligibility for transplant, person of transplant for autologous or allogenic, person candidate with a rate compatible donor, and the total unrelated donor transplant need to know your gap factor, person served with other stem cell sources, or you're going to use mixed or single and double cord transplant. That estimated number of cord blood units used. Here you have in your right the net cord inventory. Nowadays, net cord is not publishing. This is for 2019, but I would like to show in this diagram that the use of cord blood is equal, and probably nowadays more for adults than in infants. And on your left, you have the best case demand for cord to increase 2.5 times over 10 years, comparing 2008 to 2018 in United States and international models. The high birth rate and relative healthy nature of these babies born in our state make in an ideal location to collect umbilical cord blood, especially in those countries where minorities as different ethnics have troubles to obtain an unrelated donor. The financial support, the funding to create and sustain the bank will be sought from local sources, especially government health authority. But you can see in the diagram the continued growth basis on historical rates. In blue, international unit growth. In yellow, domestic unit growth. The demand of cord blood units will rise independently of your inventory levels. New cord blood bank must have an inventory around 500 units, and it's necessary to go again to the regulatory authority before you are going to the accreditation process by ABB or FARC network. Cord blood banks change transplant an average around $30,000 per cord blood release. And an important information is that at least 4 to 5 years are needed to continue to expand the inventory in your bank to allow and acquire a volume of units to facilitate to support the cost of running the bank. And in different cases, it depends of each state or country. Here you have a comparison during the year number 1 to year number 7 in a state cord blood bank pro forma, where you can see not the number, but let's see to the left column about units stored, the cumulative inventory, how many units have sold, the core brand revenue, and the cost. You have recruitment, processing, storage, overhead, distribution, equipment, and new employee training costs. The units stored are the number of units that are banked. The core blood collection program has collected over 2 years of data, including the number of births, number of collected units, and number of units banked. In general, core blood bank use this data set to determine the number of units that can be banked. The cumulative inventory is the total of units banked for all years. Core blood units sold, the number of core blood units sent out for transplant and reimbursed for insurance companies. And the sales out from a specific core blood bank shows that around 1% of inventory will be sold when inventory is less than 2,000 units, and 3% of inventory when you are over 4,000 units. To be conservative statistically, organizations choose to estimate that 1.5% of their inventories will be sold over 2,000 units. Here you have the pro forma explanation and assumptions revenue, where you can see again the price of $30,000 for to be conservative, the core blood revenue gift, and the total revenue, core blood revenue plus your gifts. Recruitment costs include salaries, supplies, and other direct collection costs. The processing costs include processing of all core blood units processed, not just those banked, include salaries, supplies, and other direct processing costs. The storage costs is the cost of storing banked units. And the overhead costs include quality assurance, travel, phone, and other indirect costs, distribution costs, equipment, and new employee and training costs. Here you can see that the recruitment costs and processing costs are the more important because the expenditure are around 75% of the overall cost. Here you can see two diagrams. In your left, the net income per year. In your right, cost per unit sold per year between the first year to the seventh one. And once again, the quality is very important. You have to know and follow the standards. You need the planning, laboratory processes, control, assessments, and improving. And the quality in core blood bank requires monitoring and evaluation, quality plan, quality policy, training staff, quality manual, different procedures or work instructions. Here you can see the whole process between the collection at the hospital or maternities, different processes with a very close relationship into your lab, and the companies or hospitals that are processing on depends the kind of stem cell that you are using. Core blood banking business plans, need rules, compliance, standards, guidelines, review, laws, codes, audit, and procedures. The second one is to follow a quality management. The third step is to know and follow your rules and regulations in your country. And of course, very important to have accreditation processes by ABB or by FATNetCorp. You know that the accreditation process is a voluntary standard, and you know in the United States, the National Marrow Donor Program, ABB, FAT-Chasey, NetCorp-FAT. And here you can see the accreditation process and how to get started by ABB. The first step, you have to visit the ABB web page and choose the appropriate ABB accredited activities, in our case, core blood activity. The second step is submit these documents to accreditation ABB email. They help us to determine the accreditation requirement for your facility, labeling questionnaire, infection disease testing questionnaire, core blood questionnaire, location and activities table, institutional membership application facility personnel, and the last step was the upon receipt of membership dues, you will receive a copy of the current edition of the ABB standard for cellular therapy services, an instruction for performing a self-assessment, the first step in preparing of your on-site assessment. In the case of Foundation for the Accreditation on Cellular Therapy, FACNETCOR, is a very similar condition. In 1996 was the co-founded between the American Society for Blood and Marrow Transplantation and International Society for Cellular Therapy. The purposes are to establish and promote standards for quality in laboratory practices in hematopoietic progenitor and transplantation, and in the clinical programs appears chassis. Here you can see both kind of accreditation certificate from ABB, from FACNETCOR. And once again, the quality is very important. The quality management know that you show you that in the interdependency of qualification and validation, the high quality materials confirmed with qualification and consistently performing process confirmed with validation. The quality management plan must include a process to qualify equipment, supplies, and reactions to confirm their consistent function in validated procedures. Once again, you can see here the different process in the PDCA model by ISO. The standards are designed to provide minimum guidelines for cord blood bank facilities and individual performance, cord blood donor management, collection, processing, testing, cryopreservation, storage, listing, search, selection, reservation, release and distribution, or providing support services for such procedures. Each cord blood bank facility and individual should analyze its practice and procedures. And you need to know compliance with the standard is not an exclusive means of compliance with the standard of care in the industry or community or with local, national, or international laws or regulations. Once again, the needs of accreditation processes and quality processes. The cord blood bank shall establish and maintain policies or standard operating procedures as this is critical aspect of operation and management in addition to those required quality management requirements. This document shall include all elements required by this standard, and you could find it at the NetCorp International Standards or the ABB Advanced Transfusion and Cellular Therapy Worldwide International Standards, from collection, banking, and release for administration as cellular therapy. 3 messages about cord blood banking. You have to know the consent in order for cord blood to be collected for banking. The mother must give her consent. Safety, all licensable activities must be carried out by properly trained professionals. And quality, all licensed cord blood bank must meet minimum standard for quality management and safety. And it is important to know that beyond these minimum standard practices can vary between cord blood banks. Here you can see the cord blood bank business plan, topics to keep at home. On your left, the enterprise processes, the agreement processes. In the middle, the project processes, planning, assessment, control, decision, risk management process, configuration of your management process, and information about this process. And in your right, the technical processes, stakeholder requirements, requirement analysis process. You have to need the architectural design process, implement processes, integration, verification, transition, validation process, maintenance, and disposal processes. Here you can see the cord blood process from the collection to the cryopreservation. It was images from 2002 at the moment that I was doing training abroad, and there's Dr. Pablo Rubinstein supervision at the New York Cord Blood Bank. And Please remember that the umbilical cord blood needs an architecture design. Here you can see different images that we know to need in a cord blood bank. The indication of cord blood banking are unrelated for allogeneic cord blood transplant for hematological diseases, directed for siblings of a patient with leukemia or another disease curable by allogeneic hematopoietic stem cell transplant, or autologous for potential use later in life for classical indications or new cell possible potential therapy options. The cord blood bank business plan summary. Probably cord blood is a unique biological resource for hematopoietic transplantation, scientific research, and regenerative medicine. There is a need for increasing the number of units stored. For this proposal, you need many people working together. Of course, you have to know the whole process very well. Once again, you need to manage the quality improvement plan because your beginning is about your plan with your objective, questions, and predictions. The plan is carrying out the cycle for who, what, where, and when. You need to carry out the plan. You have to study document problems and unexpected observations, and of course, begin data analysis, so important. The step is to complete the data analysis, compare data to predictions, and summarize what was learned. And the action plan is what changes are to be made and how it's going to the next cycle. ABB offers us 10 components to know: organization, resources, equipment, agreements, process control, documents and records, deviation and non-conformances, internal and external assessment, process improvement, facilities, and safety. Of course, to see your cord blood bank grow, you need funding. And to know the last imagine is that the success doesn't come and find you, you have to go and get it. For instance, you have to start your cord blood business plan. These are my acknowledgement to my mentors. Thank you for all of you for attending today this webinar.